All right, let's shift gears now and focus on the conversation of the day, and that is all about the impact of climate change on health, because today, that is every single 7th day of April, the world celebrates World Health Day, and this year's theme is Our Planet, Our Health. So what is the correlation between the two, and what are some of the individual, responsibilities or roles that we play, to get to where we are at as far as climate change is concerned? Well, that is what we want to understand. So like we're asking you today, so what should be done to create a safe and, of course, clean environment? That is what we're asking you today. What should be done to create a clean and safe environment? So keep tweeting at NTV Kenya, at Lubembe_Winnie. Remember to use the hashtag #YourWorld, and let's have a conversation on the same. So very quickly, let me introduce my panel for the day. So joining us via Zoom, we have Dr. Mercy Mwangangi. Of course, we all know her, our Chief Administrative Secretary at the Ministry of Health. Good morning, Dr. Mwangangi. It's very good to see you this morning. How are you doing? Dr. Mwangangi, can you hear me?
Yes, I can. A bit of a network challenge there, I think, but we should be able to proceed. Yes, so today is World Health Day, and the theme of World Health Day this year is Our Planet, Our Health. And I think the theme is very apt because it planet.
Right.
And particularly noting and understanding that.
All right, Dr. Mwangangi seem to have a bit of a challenge, getting to you, but of course we're sorting that out. Before we do that, of course, we also have Josephine Wawira, who is an environmental communications specialist. Good morning, Josephine. It's good to see you this morning. How are you doing?
Good morning. It's
All
a
right.
pleasure to be here.
Karibu sana. And of course, we also have Dr. Shamsa Ahmed, who is a consultant physician. Good to see you again this morning, Dr. How are you doing?
Good morning. Thank you. I'm doing well. Thank you for having me today.
Karibu sana. And of course, we'll also be expecting Karine Boomsma, who is a climate expert, to also come and just help us understand how the two relate, and that is as far as health, together with the climate change. What is the relationship between the two? But like I said, the question that we're asking you today is what should be done to create a clean and safe environment. So again, keep tweeting at NTV Kenya, at Lubembe_Winnie. And I don't know if we have Dr. Mwangangi with us. Have we sorted? Because we want to start with Dr. Mwangangi just to understand the importance of this day, and that is on World Health Day. So what exactly and how important is this day, Dr. Mwangangi?
The day is very important because we have to appreciate that we live in a planet that we have to conserve, and that there's a very key interrelated relationship between environmental health, our planet being healthy, and our own selves being healthy. We always say that if we have a climate crisis, then we have a health crisis. And the relationship between our environment and the climate and the health sector is very integrated. People do underestimate the twin effects between the climate and the health system. Climate change variables such as floods, rising temperatures, disruptions in the environment do actually cause diseases. For example, if you look at diseases such as malaria, if you don't drain waters near your environment, near the bushes, if you don't clear the bushes, you're bound to then get malaria. However, if you look at conditions such as filariasis, if you look at many medical conditions, even skin cancers, all these are...
All right, go ahead, Doc. All right, okay.
Did you get that? Are we clear?
Yeah, do you want to take that again? We missed the last point.
Yes, so what I was trying to say is that the health system, remember the health system is a heavy consumer of products and technologies. If we look at our supply chain, if we look at the waste that is produced just from the health system, And so the relationship is a sort of two-sided coin relationship, that one, climate change disruptions in the environment can cause diseases, but the health system in of itself is also a contributor to climate change. And so that is why today is very important as we discuss a healthy planet and our healthy bodies and our healthy selves, because the two are very interrelated, and it is important that interventions are put in place to ensure that both the planet and both ourselves are healthy.
I like that. All right. And of course, you see, most of the time when you talk about climate change, it seems very far-fetched. It's like that is more of, a government thing or, the international partners thing. But I like the fact that she said, at the end of the day, it's all about us as a people and what we can do to make sure that we have a clean and healthy planet, which, of course, that translates to our well-being. All right. But Josephine, like I said, seems very far-fetched, right? What are the things that we do on a day-to-day basis, sometimes conscious, sometimes unconscious, but one way or the other ends up, messing up the environment and, in turn, climate change?
True. I think if we look at it from the very basic level of it, when you throw away a plastic bottle into the environment, that then ends up clogging the drainage.
Sure.
And then, at the end of the day, if you look at where that drainage goes, it's back to our own systems, and we end up drinking that water.
Sure.
It's sad that at this day and age, we have results showing that we have plastics in our blood system. And we have to look at what is our contribution to that. Communities that are living surrounded by uncontrolled, dump sites, and at the end of the day, coming back to affecting their health. When we burn our waste and that pollution goes back to the environment and we inhale it, it affects our health.
Yeah.
And then when we use, for instance, non-organic fertilizers in our crops in agriculture, and then we consume the same crops, and then that goes to our environment. So when you look at the cycle, we end up contributing to the same things that are hurting us today. So it's not far-fetched, really, if you look at it in that way. And we have to look at what we are contributing individually before we look at the bigger picture of what someone else is doing.
Yes. Because most of the time it's easy to point a finger at the government. It's like, you're not doing this. Why do we have, sewage, for instance, in urban settings where, like, you walk around and, number one, the environment is not clean, and we start blaming the government. What are you doing to make sure that you deal with this mess? But it starts with us throwing that one single bottle. And I know you're very passionate about the same, and especially when plastics are concerned. Of course, we'll also come back to you, more for the same. But Dr. Shamsa, in terms of then our own health, right, and just our bodies, sometimes we might not see the impact of, climate change, like, on a naked eye, we might not really see it. But then again, what does that look like for us as a people and our health?
So for us as individuals, when you look at diseases, there are two branches. There's what you call non-communicable diseases, the NCDs. Now that one means if it's my disease, I'm not able to transmit it to you. The only way I'd be able to share it is through my lineage. So as a mother, that means if my children look like me on the outside, the genetics are going to be the same. So that's going to be things like asthma, and the other kind of diseases are the communicable one, or the infections, which is something like COVID that we saw the devastation. If it's mine, it's very easy for me to transmit. So when you're looking at our environment and how that's impacting us, when we look about the diseases that would primarily only belong to me, that's like something you mentioned, the chronic obstructive pulmonary diseases. And that comes from our environment, the exposures we're having to air pollution, to smoking, that kind of stuff. You find that, like with most women who are above the age of 60, if they come into hospital and they're having a cough and, having a bit of difficulty breathing, the question we always ask is, what do you cook with? So when you look at people who've been cooking with firewood or, those kind of stoves, they tend to develop these chronic lung conditions. And, that means their children are being exposed to this and growing up with that. So, we have to look at what are the alternatives do we give them, as opposed to just saying, no, you're not supposed to use firewood. When you're looking at infections, you can have a bacteria or a virus, but it still needs an environment for it to thrive.
Absolutely.
And when we're affecting our climate and affecting our temperature, areas that used to be hot may be getting hotter. Areas that were cool, like Nairobi, are also getting hotter. So diseases that we always knew, if I go to Kisumu, if I go to Mombasa, that's where I'll get malaria. Now you find it's changing. And you know, you still need that kind of temperature, like when we have cold seasons and you're getting more flus and you're getting more upper respiratory tract infections. And you see, we don't realize that we are the ones who are affecting that environment, and we are creating that environment that's going to push us to have long-term illnesses and affect our quality of life. And we'll keep getting these infections that also affect our quality of life.
So it's more like we're bringing all these things to ourselves, but still complain.
We're definitely participating.
Okay. All right. And Karim, thank you very much, finally making it to join us on the conversation. So over the last few years is when we really, have had this conversation about climate change, over and over and over again. But still, there is still a bit of how intense, number one, the situation is. So can you just help us understand, like, how are we doing when we say climate change, right? Where are we at?
Yeah, so we are at a point, I think, in general, globally, but also in Kenya, luckily in Kenya, because I think we're quite early adapters, I would say. So we've all accepted the fact that we are facing climate change. And that was not the case a couple of years ago. We're still debating about it, and was it not so bad here, but it was worse somewhere else. So I think we finally all really accepted it. It was also in the COP 26 this year. And we have in Kenya actually great national plans and policies, and you see that the government really develops plans that are looking at how to mitigate climate change and how to beat that collectively. Now, so that's where we are. But what we now need to do is start implementing it or start actioning it. And that's not so easy, as what you say, like everything is linked together and everything is connected. It's a current system we're operating in. So as what you say, you cook with trees, we cut down trees. So it's not only bad for our health the way we're cooking, but also we are cutting trees at the same time. Then the question is, what is the alternative? So we need to change the system. You cannot say, don't do that and don't cook. We still need to eat. So it's really a big system change, and we say that the circular economy could help with the transition to meet or mitigate actually the climate changes. And then it comes with all those kind of things. We need to develop a different cooking stove. But if we do that, maybe the cooking stove can be also solar powered, so we can have electricity that is also renewable. Then we maybe have access to internet even through a cooking stove. It's possible nowadays. And we use organic waste to create pellets, and those pellets are much more healthier. First we solve the waste, then we have actually an alternative for fuel, and then we have a much healthier cooking stove. So, and that's a tiny thing in a very big system, but we are just animals, we are mammals in this world, so we're part and parcel of nature, and that's why it's impacting us, and we need to find that connection back, I think, and the complication at the moment is, I think the willingness is there, and everyone understands, but now we need to connect all the dots and make sure we do it together, because you can't. You have to have you have to have alternatives, and you need to know how to access it, and you need to understand why you're doing it.
Absolutely. And of course, we can't just point fingers and say, don't do this, based on what you're saying. You need to give people alternatives. We'll look at, the mitigation measures, a little bit later as we continue with the discussion. But Dr. Mwangangi, let me bring you in this sense. Dr. Shamsa, again, mentioned some of those things that we've had for, a very long time, and that includes communicable and non-communicable diseases. But then again, like I said earlier on, understanding the intensity and how the environment, plays a factor in the same is one of the things that we need to consider. Again, I was reading, and they were saying 1 in 3, I would say, infections actually caused by the fact that we're cutting down forests. And of course, there's also a mention of SARS, infection. So how is this? Like, where do these bugs come from that they enter into the human beings? How is that possible?
That's a very good question. And I like what the last speaker has said, that, it's all about an interconnected system, and that we as human beings are just but a part of this whole huge ecosystem. And we need to learn how to survive within it and to thrive within it. You've just mentioned SARS, and of course, right now we are dealing with the COVID-19 pandemic. And one of the key things that we need to look at is to appreciate that where you live, where you dwell, your dwelling actually affects your health. And there's several that affect your health.
All right. We missed some bit of your point.
Now, thank you. Yes, I was just checking. Yeah, I was just checking if we're still together. So, yes. Dr. mentioned a very important in terms of you have communicable and non-communicable diseases. Some of the lifestyle choices we make, for example, air pollution, one, through how we cook, but two, even through our own constructions, through the architecture of our buildings, does actually have an impact on our health. If we look at risk factors such as tobacco smoking, it's exposed as, not to just detrimental effects in terms of cancers, but also in the environment, the environmental effects of smoking that come into play. When we look at our food systems, how we eat, how we dispose food that we've not eaten, how we're able to actually ensure our food system is healthy and is sustainable and is efficient, again, affects our health. One, through direct diseases, diabetes, hypertension, those are the non-communicable diseases, but also in terms of pollution, fecal-oral transmitted diseases. So the key thing to note today as we celebrate World Health Day is that all these things are interconnected. There's no one facet of life. If we look at energy, fuel, electricity, water, our environment, what we breathe, it's all interconnected. And that's why we're trying to share the message that our planet, our health, completely interrelated, and we need to ensure that both are healthy.
All right. And of course, the question is more on awareness, because you see, the things that we're mentioning is like we've grown up knowing these things, right? And we see them even on a daily basis. And now with the evolution as far as technology is concerned, we have access to some of this, information. But still, we're just doing these bad things, that of course has an impact as far as the environment is concerned. So when it comes to the awareness, how does then the health ministry, for example, let's just say the government through the extension of health ministry, then come in to emphasize, the importance of the two?
Thank you. So one, Kenya has made a lot of gains, particularly when it comes to commitments, when it comes to climate mitigation and adaptation strategies. We've been able to, one, through the Ministry of Environment, actually develop climate policies and strategies that are effect within that ministry, but also in terms of whole of government approach. I think COP26, our president, His Excellency Uhuru Kenyatta, made very, very impactful commitments when it comes to the reduction of emissions within the country, when it comes to use of good, clean, green energy. And when it comes to also, I think for the first time actually in the last COP26 in Glasgow, there was actually a focusing on the health sector and the role that the health sector plays when it comes to climate change, but also how the health sector can be redesigned to be able to offer good health services and not to be a contributor to emissions, in terms of, contributing to the ill effects. And so right now, as a Minister of Health, one of the key things that we are working on is to actually complete our strategy. We've been able to undertake various resource mobilization initiatives to ensure that the resources are available to talk to communities and to be able to engage communities, particularly at the primary healthcare level. In the last devolution conference that was held last year in Makueni, climate change was actually the big theme. It was an interaction between climate change and health. And different counties were able to demonstrate how different health facilities, different health systems have put in measures to combat climate change. For example, now it is policy that our health facilities, where they have space and land and plot, those spaces should be utilized, for planting trees to increase the tree cover that we have. When it comes to our water systems, we do have plans underway to ensure that the water systems in our health facilities are efficient and are sustainable. And then, of course, when it comes to waste management in our health facilities, we're looking to ensure that waste is managed in a manner where it doesn't.
All right, a bit of technical hitch over there. I don't know what's happening to the internet today, but it's fine. We will still get your points, Dr. Ari. And I'll come back to you because, you see, it's very easy when it comes to just pointing down what we need to do. For example, like you said, planting, aspect of tree, waste management. But the question is, when it comes to then climate funding, do we have the resources? And even as the health ministry, is there a way that we are prepared as far as these emerging, diseases are concerned? Because again, it's like the situation is getting worse when it comes to climate change. So what are some of the mitigation measures that are being put in place by the health ministry? But before I come back to you, Josephine, so Dr. Mwangange mentioned an aspect of tree planting, which again is more of tree growing, right? Like you plant and then make sure that that tree thrives. But also the question is then, what do we plant? Do we know what we're supposed to plant, just to help us with the environment conservation, so that we're not just planting trees because, well, the government said we need to plant trees.
Yeah. I want just to connect that from a point that you mentioned from, the causes that we experience. And sometimes, until it happens to you, you don't really understand. Because if I say, for instance, that as a country we aim to, cut down greenhouse emissions by 32% by 2030, to someone when they hear the big figures, they're like, what does that even mean? But I want to give you a very simple example of a time when I used to use Jiko. We almost, a lot of households use that.
You do, yes, in the country, yes.
And then more than 2 times, my child fainted every time, and I didn't understand what was happening until someone told me, what do you use to cook? At that time, even if you're using the other means, we say when we are boiling beans, those cereals for the economy,
yes.
You use Jiko.
Yeah.
But then again, I thought, what if it happened when I'm not there? And thousands of lives, and especially of children, are lost every year to the household emissions alone. And now when you look at the bigger picture, for me to use that Jiko and the thousands of households that use, it's a lot of cutting down of trees. And we are looking at covering 10% or tree cover by actually end of this year.
Yes.
And it means we have a very big gap to go. And because currently we are at around 7.2% thereabout. And so it's everybody's role to come in and contribute to this, because it is for all of us. We have to start from, stop, first of all, cutting. And even if you cut, because sometimes there are things that we'll need, then are we replanting? And even if we plant, sometimes we have corporations coming, down and doing all these big campaigns and planting trees. But the moment that tree is put down on the ground, the story ends there. Are we doing the follow-up after that? Are we ensuring that we do research and understand this area needs this type of tree for it to prosper after that? Are we following up to make sure that the tree didn't die after we planted it? Because more often than not, myself having practiced it, I planted tree in a very small space, trees around, but then again I was told almost 50% of them died and they have to replant. So there's this need to do that follow-up from both the institutions that are participating, and I'm so proud that the private sector has come out strongly to support the government towards this initiative. And everyone coming together to re-nature, the country. It's very impressive, but let us go beyond putting down that tree and, coming down to also creating awareness on the small steps that we need to do. It's unfortunate to see, because of the heat waves that are going on, we have forests now, coming down with fires, with the recent being Mount Kenya. We have to understand that there are communities on the ground that their livelihoods have been affected. And discussing and connecting this with health, we have to look at impacts of climate change beyond just medical health. We have to think there are communities, because year after year we see droughts recurring and recurring, and communities have become susceptible to malnutrition as a result, and in worst case scenarios we have seen deaths. We have flooding and the locust invasions that we have seen, and then we have crop damage, after that. Communities are affected.
Absolutely,
and access to healthy, clean and safe environment is a right provided for each one of the citizens by the Constitution. But is everybody
On
accessing
board.
that?
That's the
Is
issue.
everybody benefiting from this right?
Okay.
So let us look beyond the medical aspect of the impact of climate change to the very basic of how do we describe a healthy nation?
That's true. And Dr. Mongagi, can I just throw that to you before it loses Joseph's point in terms of access, you know, and it's a right and it's enshrined in our constitution, but it's just sad to see like almost half of the counties, you know, in the country are experiencing, for example, drought right now. And then it's like we're always experiencing both extremes. It's either there's drought or there is flooding. So then when it comes to that aspect of it's everybody's right to make sure that they have access to, you know, food, clean water, and of course that aspect of making sure that you have like, you know, balanced diet and health as well. What is the issue?
Again, a very good point. If we look at our country in terms of progress to access to water, access to food for different communities, access to clean energy, Kenya is on a journey, and we have made you know, modest progress in those areas. But of course, there's still gaps, and the current drought that is taking place, you know, exemplifies the gaps that are there. One of the key things that we need to appreciate, and I think the previous speaker did speak to this, is that there is actually a role and responsibility of all players within the community. As we speak right now, I'm aware that the Ministry of Devolution, together with county governments, are working to see how they can secure communities who are experiencing drought right now through provision of food rations. But then, of course, the conversation needs to go further than that. You know, conversations need to be held on how do we ensure the water system and infrastructure is actually able to feed that community. And if that is not, you know, a plausible intervention that will have utility there, how do you ensure that the food systems are sustainable? As a Ministry of Health, we are working with the communities there. We do have participation in the disaster stakeholder committee. So we are members of that committee. And we are providing different food subsidies as well as commodities, medical commodities for the children, particularly who would be affected, as well as the adults who are affected. I do like what the speaker has said, and I really would want this to be the take home as we commemorate this day today, that all facets of our living are interrelated, you know, and that the climate change and the health system are what you'd call twins that are interwoven with a thread, and that we all have a role to play. Often one of the things that we're trying to work on in the ministry is to put out a communication package that articulates the role that you would have as a patient, as a client in a health facility, but also the role that a health provider has in one, mitigation, but two, in an adaptation within the health system, within the health you know, within the whole health structure. And when I talk about the health system, let me also be clear, I'm not just talking about the health facility. This, you know, also starts from the community and, you know, all the way to tertiary systems. It includes also our supporting and enabling entities in health. For example, we know technology and IT is a useful enabler in health. Many people would know that we have a lot of equipment and infrastructure in our hospitals. How do we utilize this infrastructure and ensure we get the best out of its life? And then how do we dispose this infrastructure? Of course, this conversation can be extended even outside of the health system when it comes to basic household goods. How do we dispose, you know, fridges? How do we allow importation of those goods into the country? And so the conversation on climate change is actually touching on each and every system of our living.
That's true. And of course, it's so huge that we can't just finish in one sitting, but of course we can try, you know, and just drive these conversations. All right. So right about now, let's answer a caller. Tina from Mumias. Good morning. Tina, are you there?
Me.
Hi, how are you?
I'm good.
Thank you very much for calling us this morning. Do you have a question or a comment?
It's a question come comment.
All right, go ahead.
You mentioned something. You actually ended your sentence by saying, do we know what we are planting?
Okay.
And then my question and a comment goes to the environmental communication. I come from a county where we have so many, the climate is very favorable. We have rains, we have trees, we have everything. But now when I was growing up, we had rivers which were flowing. There were wide rivers and there were big rivers. But now because people, I think, were not told what to plant, they planted blue gum along the river banks.
Right.
All the rivers in that county have been reduced to mere streams.
Yeah.
There's no more water flowing. In fact, they have narrowed up. They are tiny rivers, and it's in the whole county. I was wondering, can somebody do something about getting the blue gums out of the river banks so that we can have the rivers back? Because as time goes, I think those rivers are going to be extinct.
That's true. All right. Thank you very much,
Tina. In Nyamira County, where we have such, yes.
Okay. Thank you very much, Tina, for that concern. And of course, I'll throw that to the environmentalists and, of course, climate experts, Boomsma. But Josephine, do you want to start us off?
Yeah, I think looking back at our childhood, and she brought back a lot of memories when she started by saying, I saw those rivers when I was young, they were flowing, and there was all this joy of swimming by and playing and, grazing cattle, or like it was a lot of fun, and the connectivity of the environment in our growing up and our being brought up, even today when you look back at all the circular practices that we used to practice, like using manure to farm, and so it's really sad. And I think first of all, it's a lack of awareness that somebody went on and planted blue gums and then they ended up sucking up all the water, and it is something that can be reversed. But I think the first step would be awareness creation. And like I said, before we plant trees, it's good to do research and understand what kind of climate we are in. Good thing that she mentioned that they have very good and favorable climate for trees and for those kinds of things. So it's a reversible situation that can be done. The stakeholders involved, including the people who planted the trees, the community itself, and even the local government, just coming together and understanding that this is the damage that is being caused by this sort of a tree being planted in this area, and how do we reverse it? How do we change the situation? How do we bring back our rivers? Because a river like that, which is a source of feeding for farmers, drying up then affects way more than just the river not being there physically. And I think Karine would be very interested because she was like,
yes, I heard her reaction. So Karine, what is it about the blue gum?
No, but it's sad. It's sad to hear a beautiful story and then suddenly you will be taken away and we are ending in a nightmare. Well, probably people were not aware even that they did something wrong. You just plant another tree. But they are very invasive. I mean, in Karura Forest in Nairobi, they've taken them all out slowly and replanted the indigenous trees. And the indigenous trees will not only bring back the ecosystem and bring back the water, but also the rest of the biodiversity. You get very different animals and insects and other life if you don't have your indigenous trees. And what that means is very simple. What type of vegetation, what type of plants and life do we have in this area? And that is for a reason. That was designed for a reason. That was there naturally.
Yes.
So it's just sad to hear a beautiful story. The good news, I think, there's the sad news is we lost that connection. Like, we actually knew that. I think a couple of generations ago, we did things naturally better than we do now.
Okay.
The good news about it is we've created this system. That's our capability as our special mammals or special mammals. We can imagine something and then create it. So yes, it's the complete system. So it's a whole economy. So it's a very big thing to change. You have to transform everything. And then also coming back to your first point you made about how we're going to finance that also. Like, how do we do that? Is there money to do so? And I think we need to create new values. So how is it possible that if you cook on organic waste converted to pellets, it's still more expensive than charcoal? Why? that will not help.
That's true.
So we say
to
do things environmentally friendly
Yes.
and circular, for instance, and recycle our waste is expensive. No, what we've created is too cheap. We have created things where we not incorporated the negative impact on our health, the negative impact on our environment, and that is a price we're paying. So if the bill for the Ministry of Health is based on how well we treat and work with the Ministry of Environment, I always wish that they could all be together, trade, environment, and health, because everything is connected.
Absolutely.
So that's what but there are possibilities. We just need to look at what was said before. It affects everything. And yesterday we launched a report deep diving into agriculture. It's so close to us. It's literally what you put in the soil and what you do in the environment. That's what we eat. If you feed a chicken bad stuff, you're ending up eating
the one
it.
who's eating the chicken.
Yes, and so it's bad for the chicken, it's bad for the environment there, but it's bad for us at the same time. And we can do it very differently, and it's actually could be cheaper, much better, much healthier, and in the end we will thrive all together instead of fighting all the bad things that we're causing, where we're trying to always, I think you will experience that as a health expert. Doctors are there to solve issues. We wish we could solve lifestyle before you create the issues that you now have to solve. And I say, doctor, can you help me? I'm really
and yet
sick.
You could have solved it yourself. All right, Dr. Shams, of course, will tell us more on the same. And also, Dr. Mwangangi, that aspect of can all these ministries just work together, so that we can prevent most of the things. But right about now, we also have another call on the line. Nelson, good morning.
Hello.
Hi, how are you?
Fine.
Thank you very much for calling us all the way from Nandi. Do you have a question, or do you want to, do you have a comment for the discussion?
Kiingereza sana, ongea Kiswahili.
Sawa sawa.
Unajua hii watu, nimeambia hii watu amependa nini sana. Amependa kupasua maboko, kukata mamiti, kuenda maforesti. Na unaona tu naenda kukata miti na kubeba na kupanda nini pluka mkorifu mtoni na cypress na imelima mtoni, imelimwa sana. Ukichunguza mtoni yote imelimwa na kupanda mboga. Na hakuna mtu naeleza hawa msipande miti, msipande mboga, msilime nini mtoni.
Okay. All right. Asante sana, Nelson. Of course, very, very, pertinent concerns that Nelson is raising over there. Asante sana, Nelson. We'll try and answer your question. And of course, Bumsum, I'd want you to answer this because I think it's one of the things that people just find it easy to go for, and that is the bluga, right? And then he also mentioned an aspect of cypress, people planting cypress, again, close to the river banks. And then there's also encroachment of the banks, people over-tilling and just trying to make sure that they can plant vegetables over there. So is this a risk? Is it not? And what can be done to, change the situation? But yeah, let's just answer that and then we'll come back to Dr. Shams.
Yeah, so again, I think it can work all together, but you do need to do it in harmony. It's not balancing out and trying to see what works on this end and then, okay, now it's enough on that end. It needs to be done in harmony. So agriculture can live next to having trees. We don't need to cut down all trees. But again, I mean, if you can maintain the biodiversity and the trees that should be there, it will actually make your soil much healthier. It will create an environment that probably will increase your yield while not losing your ecosystem. I mean, literally, if we don't have bees, we won't have food. So if you cut everything and then you grow your crops, you probably have eroded soil quite quickly after that, while we can do a combination of that. Okay. And I also think you should, if you live in harmony with nature and you can combine it, and taking and the social and environmental aspects in consideration, then there's enough water for everyone, there's enough clean air for everyone. So I think that's essential.
It's not all too bad, right? Okay. All right. So can we maybe emphasize on the point after the break, because we need to take a break right now, but we also need to release Dr. Mwangangi. I wish we could have you until 9 a.m. But can I just release you with, I just want to hear your parting shot as far as, of course, the budget will be read, later on in the afternoon. So what do you hope to hear from the budget, and especially as far as climate funding is concerned, and of course, merging this towards health as well? What would you say, Dr. very quickly?
Seeing as we're discussing health, it will be important to, of course, as a health practitioner, policymaker, and today discussing climate change, it will be important to see more resources allocated to climate change and to health, measures when it comes to mitigation and adaptation. And I can tell you perhaps a snippet that I do know our government is committed to this. So we will be harnessing both domestic resources and external resources towards this end. Perhaps to share with the audience is that the Ministry of Health is actually in the process of trying to process some grants that will be coming in specifically to deal with climate change issues in health. And very soon, we will be starting what is known as a vulnerability assessment, essentially trying to look at the vulnerabilities that are there in the health sector when it comes to climate change, and then to develop an adaptation, intervention for that. And this, again, has been through the efforts of COP26, where we were able to mobilize resources for that end. And so I think the future, and I'm glad what, the speaker said, we are now well aware, we now accept that, we need to pay attention to climate change. And I think now the next step is in availing those resources, and the Ministry of Health has started walking that journey.
All right. And of course, one lesson that you learned as a ministry as far as dealing with COVID-19 and of course some of these emerging diseases as far as preparedness is concerned, one lesson.
For sure, your environment matters. Remember, COVID-19 had a huge environmental factor in terms of ventilation in a home, ventilation in rooms, ventilation, in health facilities. We, of course, as a ministry, have had to now put investments when it comes to infectious disease units, and we've already started building a facility that will be the premier infectious disease unit in the country. And so I think the biggest lesson is that sometimes in times of crisis, you have to really lean on the silver lining of that crisis. And that's what we've done in the Ministry of Health. And now we have plans, investment plans that perhaps will make us better prepared for the next pandemic.
All right. And of course, we look forward to see what some of those plans are. Thank you very much, Dr. Ari, for sparing some time to just speak with us this morning on this World Health Day. So again, thank you. And on that note, let's take a short break. When we come back, of course, we'd get to understand more on as far as, the political, social, and of course economic, decisions or commercial decisions that really need to be made to make sure that we are trying or we do better really as far as environmental conservation is concerned. See you after this break. This is Your World.
inspire and transform young minds to achieve their fullest potential. Welcome to our Raka campus and also the new campus along Eastern Bypass. Enroll today at Royal Brain School Executive Kindergarten and Primary School, a unique and executive school where the future begins.
Are you a HELB beneficiary with an outstanding loan? From the 1st of March to the 30th of April 2022, we are offering you a 100% COVID-19 penalty waiver. Kamilisha malipo yako ya HELB leo.
All our dreams can come true, and HELB is the best place to empower our dreams. Kamilisha malipo ya HELB.
Take advantage of the 100% penalty waiver and clear your HELB loan today. Terms and conditions apply. Higher Education Loans Board, empowering dreams.
This Thursday, Treasury Cabinet Secretary Ukur Yatani tables the Jubilee government's final budget as Kenyans grapple with runaway cost of living and emerging shocks such as crippling fuel shortage. Can the budget for the financial year 2022-2023 offer some respite? Can the budget and the allocations therein be used to bolster Kenya's preparedness for the general election slated for August 2022? Should Kenyans expect new taxes to help meet the projected 2.4 trillion shillings worth of revenue? Can the 2022-2023 budget offer a departure from high appetite for debt? Join us this Thursday, starting 9 a.m. for a wall-to-wall coverage of all that relates to the budget.
Watu nyarire, yani hata una huruma kabisa. Yani umeketi chini hapo, ni simu unapiga simu, kasi ya simu ni kulia na hata huwezi kuihurumia jameni. Ingekuwa ni wewe unapigwa hivyo ungesikia namna gani? Ai bwana, yo hata una huruma hata kidogo. Ai gaki bwana, you're making me go bananas bwana.
To get bananas, dial *812*806#. Skiza, Non-Nation.
Next on Daring Abroad, Bernice Bore, award-winning Kenyan nurse working in the UK.
I am the founder and the president for Kenya Nurses and Midwives Association in UK.
All keen to contribute to the success of the Kenya-UK Nurses deal.
So many of us have gone back to give back to their country. For example, now I'm supporting some nurses through the English tests.
With the English test, one of the hurdles in the process. Also on the show, Marsabit's Hidden Gems, this Saturday at 7:30 p.m. on NTV.
Get peace of mind and protect the ones you love with the power of Dettol Bar Soap. It cleans and protects from up to 100 illness-causing germs. So no matter what type of mum you are, trust Dettol.
Make this feel like this with a few sips of this. Get going with Go Fruit Juice, now available in 500 ml on the Go packs.
Welcome back. Glad you're still with us. If you're just joining us right now, the show is Your World, and today it's all about the impact of climate change on health. And of course, we need to remember that today is World Health Day. So the theme being our planet, our health. What is our individual responsibility to make sure that we conserve the environment, which again, in turn, will not end up affecting us as a people and as far as our health is concerned. So the question that we're asking you today is what needs to be done to create a safe and a clean environment? Once again, what needs to be done to create a safe and a clean environment? Keep tweeting at NTV Kenya at Lubembe_Winnie. I'll be looking at your feedback in just a moment. But for now, Dr. Shamsa, then that aspect of vegetation and what's around us and how does that affect us, when our health is concerned? What would you say?
I think one of the things I think you just said is like people usually go to the doctors or fix it. By the time you're getting there, it's too late. But you'll notice with medical services, like I'm based at the MP Shah Hospital, there is an arm of medicine that is preventative and then there's the arm that's curative. And most people are moving towards preventative, you know. Curative tends to be easy. I'll tell a lot of my patients, maybe someone who's diabetic or hypertensive, I said it's very easy for me to write a tablet, write an injection. But there's that bit that you're going to have to do when you go home. So there is that social responsibility and personal responsibility, which also reflects on the environment. Like I said, I can write 100 tablets. You have to eat healthy. You have to make that decision as I go for a meeting, I go for a wedding, what am I going to eat? You have to decide that you want to do the exercise and things like that. And I think a lot of times with people, we tend to feel very powerless with that. But you see, if you look at preventative health in anything, whether it's the NCDs or it's the infections, a lot of it relies on that particular individual. And I think one thing we said is we don't notice it until it's us. You'll see that we have a lot of children now who have rickets. And long time ago, we used to think rickets would be something for maybe a low income. But now it's our high-rise babies who have rickets because they don't play outside, they're just playing inside. So how do you tell that parent, like, you know, you need to make time to make sure that your child is playing outside? Most of the places we build now don't have a place to play. Most of us had big playgrounds. It wasn't even in your house, it was some place that was nearby and all the kids would come and play. We don't have that anymore. Like, even looking at infections, like I run an infectious disease clinic. In the last month, we've seen an increase in diarrheal illness. Again, it's not in low-income areas because a lot of our thought process is all illnesses happen in low income. We're looking at middle class, upper, and why? It's the heat at the moment. Your food can't stay as long as it used to, even if it's in the fridge, which means you're turning up or, you know, making your fridge colder. You're using more electricity. So what we do is, as a society, we keep putting a Band-Aid. So we continue doing the fix it.
Not a permanent
So we have to think about it even as an individual. What is my role in my health? What is my role in this environment? What is my role in trying to be healthy? I think one thing I'd put to the rest of the panel, one thing I find with patients, even with myself, sometimes you say, okay, I'm going to try and not use a plastic straw and, you know, I'm there roaming around with my bottle, I'm not going to throw the plastic, but that's me. How do we tackle the big industries? Because I don't think my pollution will ever catch up to what a big industry is trying to give out. So sometimes you feel a little bit helpless in what you're doing. But I think even for healthcare facilities, we have to look at how do we support the environment. Like we have a Go Green initiative. So we try and make sure we have as many green spaces as possible. And I think after this, I'm going to go and ask what kind of trees we've been planting. You know, we also have a recycling project going on that works with the community. If you have things that you want to recycle, you bring it to us. We'll make sure that we can do that. And then even in the preventative arm, you know, you have to run the campaigns. For anything preventative, I told you, is responsibility in its environment. So we run the campaigns for cardiac disease, for kidney disease. And you see that we're not saying, wait till you get it, then I'll solve it. We're like, how do you live in harmony with your environment? And a lot of things we do is tend to introduce our patients to nutritionists. Because I can try and be healthy, but I don't know how.
What exactly?
So it's very easy for me to tell someone, okay, eat healthy, and I walk away. But if I'm not telling them how, then I've really done a disservice to them. So I think that partnership really needs to happen. I think what you had said is we need to actually do something concrete and not just greenwash it. So I shouldn't just do something and post it on Instagram and be very happy about it.
Tree planting.
Hashtag, tree planting. But looking at what concrete solutions am I providing for my patients, for, you know, for the community, for my family, and I think that's how we'll have to look at it.
We want to start from. All right. So before I go back to Josephine and Boomsma, we have a call line, Jerry from Kiambu. Good morning.
Hello.
Hi. How are you this morning?
Yeah, I'm not good. I was busy watching the NTV live. And I was affected by this Karura forest, which I knew for long. I'm both the so have been seeing this forest from the time I was young, right?
Okay.
And as I grew up, I had the late, and I think that nothing of trees Karura forest. So this is for information and the understanding that there are some climate change in the country when trees are happening and the winter has not been right.
Okay.
Hello?
Yes.
And now, the government has put a question of not cutting down Karura forest.
Okay.
Immediately after that year, as far as that route, I see trees cut down and this went inside the tree. They just do very much on trees, wonderful things there. So I wonder by myself, because we have to create the government and council to the government for the environmental matters. Then who is here approving this matter? Is it a person coming from Mother Computer? From the front coming through and start doing such wonderful houses? I just say no. Okay?
Okay.
Not what to cut down the trees. I don't want to have that lot of money. They are the ones who are telling.
Okay, all right, we seem to have lost you, Jerry, but thank you very much for calling, of course, that aspect of Karura Forest and, of course, the efforts that were made by the late Wangari Maathai just to make sure that, you know, environmental conservation is really, really key. Okay, so keep calling it. The numbers are down on your screen. You want to interact with us on our socials, feel free to do so. Of course, on at NTV Kenya at Lubeme_Winnie. Let's just get to understand how best we can conserve our environment and what role we play individually, not just pointing fingers, just to make sure that we conserve our environment because, as we've learned today, everything is interconnected. Now, can I just throw the question to you, Josephine and Boomsma, as far as what Dr. is asking, right? That it's very easy to say, yeah, we need to ban plastics are not good, and all those things. But then again, we still see plastics being thrown around. And one question that I hear people ask a lot is, are all plastics really that bad? So, Boobs, I think I'll just throw that to you. Are they all bad?
Yes, I mean, that's always what we say, politically and correct,
Yes.
how you say that.
Yeah.
Plastics are a great material. Mm-hmm. Yeah, we benefit from them, and they're very interesting material and works really well. Mm-hmm. So, in terms of the material, it's quite an invention and an innovation. Yeah. But they don't go away. So they take 400 years to go away. So, what we see, everything if you look around in your household. Mm-hmm. You can probably within 3 minutes name 30 items that contain plastic. Yes. It's also your computer, your phone, it's on the table, it's everywhere. Mm. But what the key problem is plastics management and the way we deal with plastics and how we design it. Mm. Because if we design plastics that we use one time and then you can't do anything with it anymore and we throw it away, then we have the problem of it doesn't go away when you throw it away. And that causes leakage, ends up in landfill, and that is really, really not great for the environment and therefore for us. So what we try to do, for instance, within Sustainable and Inclusive Business, we are running the Kenyan Plastics Pact. Now the main problem is plastics packaging, because that is used for fast-moving goods, food. So it's great because it's hygienically packed. But actually when you go to a supermarket or a kiosk, you buy something and you buy a product, but you don't necessarily buy the packaging. You don't want the packaging.
You just want the product.
You want the product. I want to drink a soft drink. I don't need the packaging, but I need it to take the soft drink and drink it. Yeah. So we need to think on how can we design, and also, so first it's design. If we design it better, then we might be able to reuse it. So eliminate all that is really problematic and unnecessary. Right. Honestly, a straw is not necessary. We have a mouth to drink with, it's not really necessary. Maybe if you have a smoothie, it's a bit more tricky, but there are alternatives. So that one we can we can
so
leave.
design better meaning do away completely with plastics, or do
No,
more
design better
quality?
is, one part is you look at what can we live without, what is actually not necessary.
Priority,
We saw it with the plastic bag ban. There was a lot of fuss and a lot of noise, but we have our basket. So it's not really essential to have plastics bags. We can have something else. So that you can just, that's why it's quite successful. Yeah, 85% success rate of that ban. Now, if you would say, do away with soft drink bottles, is a much bigger challenge, because what are you going to do then as an alternative?
That's true.
And that has consequences. So then we say, okay, there is an even crisps package, or what, which is not healthy, but you package it. So I have to look at nutritious value. But anything that's packaged as in terms of food, can we now redesign it in order for it to be reusable? So can I just come with my own reusable cup and go to a restaurant and say, can you fill up my coffee in my own cup? So a reusable model or recyclable.
Okay.
And then you need to redesign it better, because now people say just recycle it, but there's not much value in it. And then we come to the economic system again, that people say we can't recycle it because it's too expensive. No, the quality of the material is too poor to actually create value. Now imagine if you create something that you can collect and recycle back to the same product. Not even a chair, not even oil or something downcycling or upcycling, but what if that one bottle can become the same bottle again?
Okay.
Now we don't need resources, so we save on resources.
Yes.
We are not contaminating the environment, and we close the loop on the demand. I would still want to have that bottle to carry my soda, but it's going to be the same bottle very soon again.
Yeah.
And so that's where we look at with the plastics pact as well. What do we need to redesign? What do we improve on recyclability? And how can we improve collection? But also it comes down to awareness, like can we sort our waste at source? Because if you mix everything together, it's very hard to recycle and gets contaminated.
That's true.
So if we stick to, and I think then the approach is, let's look at nothing is waste until we call it waste. So everything is a material, whether it's organic material that can become fertilizers or animal feed, or like plastics can become use again. It's only waste when we call it waste, and we think that there's no use for it anymore.
Okay, some bit of responsibility and understanding, you know, what you're saying. All right, but then again, Dr. Shamsa's question on a larger scale, you know, so we're talking manufacturers. So how best then do you engage them, just to make sure that, fine, in as much as you produce plastics, but also what Bozma is saying is that we can still use the same material, same product as is, and not really having the need to recycle it and try to make it into a different thing, you know, altogether. So on a larger scale.
I think collaboration is key, because then again we need to bring everybody to this discussion. I hope that next time we're having this conversation, hopefully soon and continuously, we will also have someone from who is already practicing that, maybe a manufacturer who is you know, already incorporated some design for recyclability. It's always good to also listen to good practices that are practicing, so that we are not only looking like we are talking and nothing is being done, all right? And so I think learning from good practices, understanding what is working and what has not worked, and learning from the mistakes that have been made and how we can make that better. It's always easy to point fingers, I feel, always very easy. But if we can listen to everybody and their contribution to the issue of designing better products and better packaging, then we would understand if company A or manufacturer A is not able to redesign or to change their model, why is that the case? How can they be helped then to make it possible? Is it a policy issue? And how can the government then make sure that policy is enforced in a way that it enables, the adoption of circular economy. But if policy is there investment to make sure that it is well enforced, and that it is not, then again, if you look at it, because if we talk of bans, for instance, they are good, yes, and they have worked like she has meant 85% of the plastics ban. But is it the solution for all the plastics products, for instance? We have to also understand that there are businesses that are dependent, their livelihoods that are dependent on companies that are producing plastic. So if we adopt what she has suggested and looking at models and saying what do we necessarily need, and then for what we need, how do we make sure that it's designed for recyclability or reusability, then we ensure that we keep jobs running and also create more jobs, because the moment we adopt circular economy, we ensure that, for instance, the informal waste sectors, the waste collectors are well empowered and informed to know that they're not just there to collect waste, but they actually can create value from waste. We always say in Swahili that taka ni mali, waste is value. So everybody needs to be empowered. Awareness needs to be created to understand that in order to create a circular economy and close the loop, there are more benefits in the longer term, So it's not just about, and especially now if you look at it, Kenya, like at about 42% of Kenya's GDP and 72% of almost the total, jobs are created in the country are derived from, natural resource dependent sectors. We are talking about agriculture, fisheries, forestry, tourism, and, making sure that these sectors are sustainable enough, we can even, create more jobs and make sure that the economy is more, also, solidified, looking at the future. Because if COVID-19 is anything to go by, we know that even any entrepreneur will tell you, having a sustainable business is not just about the profits themselves, because then life happens and calamities and pandemics happen, and then we are like, oh my God, how did I miss the fact that beyond making profits, I needed to have empowered my people. I needed to have a system that also looks at the impact that I have on my people, and people, I mean your employees, your suppliers, looking at the entire supply chain that you work with, but also on the planet. So we also encourage businesses to look at the 3 Ps, the profits, the people, and the planet, and for you to become future-proof, to ensure that even in future, if anything like what happened in the last 2, now this being the 3rd year, doesn't affect your business in a larger scale anymore, you have to ensure that you incorporate sustainable models in your production.
Yeah, because most of the time we just see now, like, what am I getting now from this business? Started today and expect to see profits like the day after, so think more on sustainability. And Dr. Shams, of course, Justin also mentioned earlier on an aspect of now we're seeing a lot of plastics in our blood system. And some might ask, but how does that look like? Like, we've been having plastics all over, like, since time immemorial. Why are you saying now that it is in my blood system, and what does that look like?
I think, you see, what we've said is that how plastics degrade, is things that take over hundreds of thousands, even millions of years. Sometimes they show you this bottle and they say it's going to outlive you and your generation. That's true. These things all end up in our water systems. And it doesn't mean you're eating a piece of plastic. By that time, this is something that's very microscopic. Tiny, you can't even and maybe the difference is a few years ago, we didn't have the technology to do these tests or to look at what is in our water and what we are consuming. So that is what they mean by the time they're saying when we're doing these tests, we can see that you've got plastic in your system. We can actually see how much carbon dioxide you've, inhaled from all the smoking and all the pollution. So it just shows that even things that are on a microscopic level that you can't see will definitely affect affect
That's
your
true.
body. Yeah.
So then how will that affect a person, for example, like in the long run? Is it developing maybe breathing complications?
Definitely,
What
because you
happens?
see, some of the lung diseases that we have are some of these microparticles that we are inhaling. And usually you see with your lung, you're supposed to be able to breathe in and breathe out. So whatever's going in is clean, whatever's coming out is just the carbon dioxide that you need to expel.
Yeah.
But some of these microfibers and microparticles, these are things that go and sit in your lung. And the only way your body responds is by your immune system trying to fight it off. So you end up with inflammation in the lung. And it's not going to be a big inflammation that you're coming running to the hospital. This is that thing in 10, 20 years, you're coming in and you have difficulty breathing. And what you're seeing is you changed your lifestyle without even thinking about it. Like maybe you lived on 3rd floor and before you used to walk up very comfortably. Now you're using the lift, or if you were carrying shopping, you're giving it to someone else to take it up for you. And you were a lot more active and you become very slow over time. And now you notice your chest is a little bit tight. And then when you come in is when we're realizing, look, you've had lung damage that's been going on for 10 to 20 years. And you'll say, okay, so where were you living? Okay, so there was this factory next to my house. It's not that I was working there, but there was this factory next to my house. What was your occupation? You know, you were dealing with insecticides, those kind of things. So a lot of it is awareness. There are a lot of things that have been banned over time. Some things just need outright bans.
Yes.
So when you see that we say you can't smoke in certain areas, I don't think there's any point of a discussion, because we know that tobacco doesn't have anything
it's like
positive. You know, there's certain things that we can say, you know, you have this as positive or negative. So some things just need outright bans. The problem with environmental pollution or environmental factors, it's very rare for you to see it immediately. You'll be young, healthy, and you're running around and you don't have time to think about trees and things like that. But when you're 50s, 60s, that's the time we're meeting for the fix-it. And now I can't go back and say, you know, let's have a tree, let's go sit in the sun. Those things are not going to make a difference. So people shouldn't be worried about trying to go and get a blood test to see how much plastic they have in their blood now. You know, because sometimes even the message that we give out, they need to understand that that we're saying everything is connected. Something on the plastics, like in the healthcare industry, we have single-use plastic. And some things there's no way of getting around that. What we saw with COVID is that what now everybody knows, PPE. PPE is single-use, so there's quite a bit of waste. I think one of the things we saw that was, I think, quite disheartening was the way masks were just being thrown around everywhere. So again, like even in that system, when we respond to a pandemic, and we have to, so we saw how even local companies are manufacturing PPE and things like that, we should have been guiding them on. So you're getting this PPE, you supply the healthcare industry. How is that healthcare industry ensuring that what kind of waste needs to be incinerated? Is it being done in the right way? Is it affecting the community around them? And remember, a lot of households bought PPE. Like a lot of houses bought full white hazmat suits. It would be good to know where they threw them. Because I'm sure a lot of people were just throwing it into the regular
trash,
waste. And then tomorrow you'll say, so how is there plastic in my blood? It's because of things like that. But again, it goes back to, I mean, in that moment, you're panicked, you're worried. I mean, there's so much going on. But as part of, wash your hands, social distance, that's some of the things we should have been educated
and informed about. All right, so let's take a break. But of course, when we come back, like I said, today's that day where every Kenyan is looking forward to hear what the Treasury has to say. So I'd also want to hear from, all of you in terms of what are your expectations? Because like we said earlier on, sometimes funding can be an issue, especially when it comes to some of those things. So what are some of your expectations towards the same? But in the meantime, keep tweeting at NTV Kenya at Lubembe_Winnie. Remember, the question that we're asking you today is what needs to be done to create a cleaner and safe environment. We'll be looking at your feedback after the short break. Stay with us.
as Dr. Funiken Mamakai hosts unscripted true life relationship experiences on reality TV show Kupatana. Nia, Monday to Friday at 8 p.m. and Kupatana every Tuesday and Wednesday at 8:30 p.m. Terms and conditions apply.
You've been searching for a solution for your stubborn dark marks. So have we. Nivea Lumina 630. With a breakthrough patented ingredient, Lumina 630 visibly reduces stubborn dark marks accumulated over 10 years in 4 weeks. Nivea Lumina 630. Our ultimate solution for even and luminous skin.
Who is a true partner? They go out of their way to help you. They do not hesitate to go the extra mile. And they're always there standing beside you. They step in when you need them the most. Because a true partner is a partner kwa ground. KCB Bank, go ahead.
Come August this year, Kenyans will head to the ballot to select their leaders for the next 5 years. Time has come for the electorate you're targeting to know you better. Articulate your thoughts, plans, and vision to the relevant audiences. Reach out to us through the contacts on your screen.
Riddle. I have branches, but no fruit, trunk, or leaves. What am I?
I think the answer is human because I don't have fruit.
If wanna dance, zebra zig and zebra zag, zebra zig and zebra zag,
Zebra zig and zebra zag, zebra zig and zebra zag.
Look up, bend the knee.
Hold it at the tip and then roll it. Then you put the bamboo stick. There you go, boys and girls. You can see how beautiful they are.
Interestingly, we've never had an account with any other bank, and we don't intend to. It's good when you've got a trusted partner.
Welcome to the family, your home of all construction and manufacturing needs, because you can always bank on family.
Next on Daring Abroad, Bernice Bore, award-winning Kenyan nurse working in the UK.
I am the founder and the president for Kenya Nurses and Midwives Association in UK.
All keen to contribute to the success of the Kenya-UK nurses deal.
So many of us have gone back to give back to their country. For example, now I'm supporting some nurses through the English tests.
With the English test, one of the hurdles in the process. Also on the show, Marsabit's Hidden Gems, this Saturday at 7:30 p.m. on NTV.
Get peace of mind and protect the ones you love with the power of Dettol bar soap. It cleans and protects from up to 100 illness-causing germs. So no matter what type of mum you are, trust Dettol.
Make this feel like this with a few sips of this. Get going with Go Fruit Juice, now available in 500 ml on the Go packs.
Right, welcome back. Very few minutes left before we end the show. So again, if you're just tuning into this, all about the impact of climate change on our health. And again, like we said, it is World Health Day today. And the question that we're asking you is what needs to be done to create a safe and a clean environment? So can we take a look at some of the feedback that we have so far? Remember what we're asking you, what should be done to create a clean and a safe environment? So someone says, this is Jim Abuya, who says, what should we do? Cook it. For a common person, if you manufacture plastics, then use them and throw them. Okay, so where are you throwing them? That is the question, okay? And then at Gatwai Simon says, good environment is everything to humans. I hear you, okay? And then someone else says, if we can have the next tweet. All right, okay. So that aspect of then plastic is good, use them and then throw them, right? Boomsma. Then how do we dispose those things? Not to make it, to make, again, not to make the situation worse as far as the environment is concerned.
Yeah, so we have to, that's what we are trying to look at as well, because we have to be honest that the infrastructure for waste is not yet where we want it to be in Kenya, because we don't have a lot of places where you can dispose, for instance, in dustbins, and then it's nicely being picked up, and that system is not yet in place.
Right.
So what we do need to ask people is to just not randomly throw it in the environment. At least if you just throw it away in your dustbin at home, take it home, don't throw it out of a car or out of a matatu. That's the first thing, so please dispose it in a dustbin bag, so at least it can be picked. But that's not the final solution either. So what we're really looking at with, and there's policies in place. So the government just launched a sustainable waste management bill. And that really is going to help us to create circular solutions and much better solutions to actually take care of waste in a responsible way and reuse and retrieve materials that we can reuse, but also to actually improve collection and recycling. But we really need to improve collection and recycling because we are aware that a lot of people don't even have access to a safe disposal. There is no truck picking your waste nicely and then bringing it to a landfill. And landfill is in the end also the environment. So if we just throw everything in the landfill, it's still the environment and will cause a lot of leakage and piles of toxic waste being there. So it's very unhealthy. So definitely what you can do now is don't throw it just in the environment, please. And then in the meantime, we need to really create a system and an infrastructure that can help us to go about waste as materials in a much better way.
All right. And of course, Dr. In terms of, are there people who then are more at risk of being impacted heavily by climate change, you know, as far as health is concerned, as compared to the others, or we're in this together? Doesn't matter who or where.
No, I mean, it affects everyone, but definitely low income will always feel the brunt of things. Because if a middle class or upper middle class, if the water is contaminated, they can go and buy clean water in the single-use plastic, but they'll go and buy water. Yeah. So definitely, when it comes to lower income, they'll always be more affected because the messages will not reach them. They're already living in possibly unsanitary environments. They're not getting piped clean water. They don't have places to dispose of their waste. These are the places where you don't have proper toilets. So, of course, what happens is if you have money, you will always be able to do the fix it. Yeah. If there's a pothole, I drive a four-wheel drive. It's that simple. I won't be worried about fixing it. And then you see, if I fall sick and I have access to healthcare and I have access to insurance, I'm definitely going to do better than someone who has to possibly queue at a public facility and wait, or doesn't even have that access to a public facility, you know, in that 100-kilometer spread. So you see, that is why you have to take the responsibility for yourself as an individual, but understand that your actions will also help everybody else in society. So definitely, anyone who is lower income will always bear more of a brunt with any of these social issues.
So then the question is, remember earlier on we were just focusing on the solutions, what needs to be done to help them, and we said we can do something. We don't really have to rely on, for example, the government or international partners to come in and help us. We can try as much as possible and just do whatever we can in our capacity. So for those ones in the informal settlements, what are some of the things or changes that they can make to make sure that, in as much as we're living here, the environment is a little bit better and conducive?
I think one of the great things we see here is public-private partnerships. So if we could have a system, I mean, we have a lot of private healthcare facilities, whether they're faith-based or purely private, and maybe 3-4 kilometers from that is some kind of informal settlement. There needs to be some way for those facilities to partner with the settlements. Remember, hospital is not just doctors and nurses. You still have your public health officers, you still have, you know, the teams that deal with the environment, waste management, the engineers. So the first thing is to start looking at getting out positive messages on what can they do in their environment, as opposed to us just giving out blanket things where I say stop using, you know, charcoal, but I'm not giving you an alternative. So the first thing is always education. With everything, there always has to be education, understanding the group of people that you're trying to pass on this message to, because maybe I'm busy ranting on about, you know, diabetes and hypertension, and they're like, look, I'm trying to get money today so that I can actually eat.
Yes.
So it's about looking at that population, partnering with the facilities that are nearby, and also partnering with faith-based organizations. You'll notice a lot of people will be more likely to listen to their priest or their imam than they are to listen to their doctor.
That's true.
So you might find a lot of these messages that we're trying to get across in terms of, you know, in the environment and waste disposal and even health and everything, work really well when you're actually going down to the community, understanding the issues, and then trying to address it for that community.
Okay.
And not assuming that everyone in an informal settlement, it will work for them.
Okay.
So if you're in Parklands or in Langata or you're in Kitengela, it doesn't mean the solution is going to be the same.
For you. Yeah. Okay. All right. So Josephine, again, just recently, in the 5th United Nations Environment Assembly, that is UNEA, of course, 14 resolutions were made. But the question is then what needs to be accelerated to make sure that at the end of the day, yes, these 14 resolutions were made, that we can achieve them. Because like we always say, most of the time it's very easy for just to say, we need to do this, we need to do that, we need to make this, you know. But at the end of the day, when it comes to implementation, is where there's a very big problem.
So yeah, the treaty is an internationally binding agreement that looks to deal with plastic pollution at a global level. So we have member states committing to what you said, but then again, like you ask, what needs to be accelerated. And I always say that while we commit to global solutions, not everything that works in Europe, for instance, is going to work in Kenya.
Us, yes.
So we have to come down and understand our local context on a country or on a national level. And I would proudly say that as a country, we've made very great milestones towards, you know, dealing with environmental challenges and climate change. While we still have a long way to go, we cannot underplay the fact that, you know, and appreciate and commend the efforts and the milestones that have been made from policy levels, from business levels, and, you know, even from a community awareness level. Because she said about private partnership, but I think the now one that we need to push for is public-private community partnership, so that we have everybody in the table and appreciate what everybody else is doing.
Okay.
And so I think on a national level, you know, looking at, for instance, she mentioned the Kenya Plastics Pact. So the priorities that we need to give, for instance, number one, eliminate what is not necessary, and then innovate to ensure that what is necessary then is you know, reusable or recyclable. And third, we need to prioritize circulation. Okay. So we need to circulate what we need so that it is used in the system and does not end up in the environment. We usually say it is a waste to waste.
Oh, wow.
So if you can just remember that,
it's a waste to waste.
Yeah, if you look at it, waste is just because she said, if you think at it is something. She challenged me yesterday, and I was like, I look at my wardrobe today and I need to go back to the market because she said either because of COVID, we've been working from home, and then before you know it, you're fitting a cloth and doesn't fit anymore.
Yep.
And then, you know, she was, and I'm like, you know, I cannot go to this. I took a picture with this the last time. I don't want to visit with the same. And she was like, are you trying not to be circular? And
yet
so you need to reuse your clothes.
Okay, reuse.
So,
okay.
Yeah, it's just looking at the very simple, you know, things that we need to do at the very basic level, even before we look at the bigger level.
Picture,
I think everybody has a very big role to play. Ministries and stakeholders need to work together. We talked about the Ministry of Environment and the Ministry of Health and Trade working together. But I also, I think, would want to bring in also the Ministry of Education.
Yep.
And I think for a long time, I have always said, you know, awareness. But it's easy to educate someone who has had a concept from a very young age than someone who is hearing it for the first time when they're an adult. And it's impressive that even with the new CBC system, for instance, I'm seeing our children having environmental studies right now. So it's easier to have that conversation of environment and, you know, explaining to them what it means at their level. And then as they grow up, you know, they grow with at least the basic information, because you know, we used to do these things, but because they were not engraved in our education system, we never even used to know that we are doing what we are now advocating to do, you know.
Okay.
So I think awareness from primary to tertiary to university, incorporating that in our education systems, making sure that people are working together, the public, the private, the communities.
As well.
I think if we all put in our effort, it doesn't have to be a mountain in a day. I think small steps towards the right direction, and then we're going to get
I think that would really, really help. So I'll take that as your parting shot, because we literally have to end the show in the next few minutes. So I'll throw this to you, Bonesman, then of course I'll come back to Dr. Shamsa in terms of fine. So in just a few hours, of course, we'll all be looking at the Treasury, right? And earlier on, we talked about an aspect of climate funding. So what are some of your expectations? What are you looking forward to see as far as the budget is concerned?
Yeah, obviously, I hope it's being environment, health, those aspects, the interlinkage between them are prioritized, and there's available budget. I don't know if that's a sensible thing to say, but I'm more concerned about how we can access the funds than whether they are allocated. I think that's a bigger issue we have a lot of the times. It's that there is maybe a climate fund, but it's very hard to access because the criteria to access it are only possible to this, and then it's not possible for anyone, a medium-sized company, for instance, to access funds to accelerate their climate impact. Or I find the criteria we're setting and the complication of specific funds are quite hard. And especially when you talk about innovation. So now we want to, we launched yesterday what I said, the agriculture, and they can be found on our website as well. And it's really interesting because circular economy in agriculture is great, but the financial world is not supporting that. So you come as a farmer and you say, listen, I'm going to also grow trees. You're actually eliminating risks. And yet agriculture is being seen as the biggest risk you can finance.
That's true.
So how do you go about it? So again, there might be a massive fund, but if none of the smallholder farmers, cooperatives can access funds to actually at least say, listen, try. And then what we learned yesterday, there is now, and I'm more hopeful about that, because as we need to transform. You know, we cannot work with the old value sets and the old way of allocating budgets and then hope it comes down, even in devolution. Like, does it really trigger down to a county that now can set up a sorting site as an alternative for a landfill? Is that working? So what we saw and what we discussed yesterday, there apparently is now coming up a sandbox, they call it a sandbox initiatives, where you have an amount of money, a budget, that you can invest in innovations that we don't even have regulations for. Like, for instance, insects as an animal protein alternative, because we're feeding animals with actually human proteins that we need, and we're lacking food, and it's actually a very expensive component. Can we replace that with maybe insect protein that work really well, like black soldier flies for animals, and give that? There are now regulations coming up, and there are standards coming up, but once there's an innovation, that system is not around it yet to support it. Can we put it in a sandbox? And then you try that as a pilot, and we see if it works.
If it works,
and if it works, you can move to the next level in more traditional funding. So I'm really keen to see what are actually the criteria to access
the funds.
I hear you.
Funding. All right, and Dr. Shamsa, literally 10 seconds on the preventive care. What would you say from the budget that we're expecting today?
So
very quickly.
I hope that in that there's a lot of, again, public-private partnership. I hope there's a lot being pushed towards preventive care. Private hospitals did quite a bit in COVID, and we shouldn't kind of sideline patients who come to private hospitals assuming that they have, the finance and access. They still need to be able to be supported by the government. But I think for the general public, the biggest take home is, if we're saying it's our planet, our health, that has to be an individual responsibility. We need to think about what world are we leaving for our children and our grandchildren and the
of course,
generations
the generations
after
to
that.
come. I like that. Thank you very much, ladies, for coming by. It's a day. And of course, earlier on, we also had Dr. Masi Mongangi, who is CAS Health Ministries. Of course, in studio, we had Karin Boomsma, climate expert, just we know we're environmental communication specialist, and as well as Dr. Shamsa Ahmed, who is a consultant physician. Very, very important conversation today we had on the impact of climate change and, of course, on our health. So I hope you learned a lot from today's discussion. My name is Winnie Lubembe, wishing you a lovely day ahead. And of course, do not go too far because we promised you wall-to-wall coverage as far as the budget is concerned. So of course, my colleague Julian Zaboko is on standby on the 7th. Of course, he's coming up in just a few minutes. So enjoy the program and God bless. See you soon.